Good afternoon. My name is HM1 Pena. I'll be going over Performance Test 20, Musculoskeletal. Performance Test 20, it starts to bring everything you learned from Block Alpha and Block Bravo and compiles it all together with addition of C-collar and traction splint for this one. So we're going to start off with conducting size up. You're going to start with donning your BSI, determine if the scene is safe. The scenario for this will be a motor vehicle accident, or the scenario will be something that indicates a C-spine injury. You will then determine the MOI. For this one, it's like I said, a motor vehicle accident. Determine the number of patients. Right now we have one patient, and then request additional assistance on standby. The additional assistance I have will be HM2 Malter and HM2 Roberson. At this point, I will now ask for my assistant, HM2 Roberson, to apply C-spine stabilization. Now you'll move on to primary assessment. You'll go to the general impression. What do I see, hear, and smell? And you want to introduce yourself. Good afternoon, my name is HM1 Pena. Sir, ma'am, can you hear me? Then you want to determine the level of consciousness of the patient using the ABPU scale. Ask the patient if they're alert. Do you know what time it is? What is your name, full name, date of birth? Verbal, can they respond to verbal commands? If you can hear me, go ahead and squeeze my hand. If the patient does not respond to that, you move on to painful stimuli. Do a trap pinch or a sternum rub. The patient has a slight grimace to the sternum rub. I can now move on. I want to determine if they have any immediate life threats. I'm looking for a massive hemorrhage or something that will be an immediate life threat. I can then move on to assessing the airway. Since we think there is a C-spine injury, I'm going to tell my assistant to go ahead and perform a jaw thrust maneuver. Assistant, can you please perform a jaw thrust maneuver? I can now look inside the airway. I will then move on to breathing. What do I see, hear, and feel? I go ahead and examine the breathing. What do I see, hear, and feel? Move on to circulation. You want to check the pulses. Go ahead and check the pulses, the slow extremities. I will also perform a blood sweep. Full blood sweep. Then you move on to CTC, checking the color, temperature, condition. If patient has signs of shock, pale, cool, diaphoretic, I would apply a blanket. I will then determine the patient transport priority. Then I move on to secondary assessment. Head to toe assessment, head to toe we treat as we go. We use that DCAP BTLS to inspect and palpate. Go and start at the head, inspect the head, eyes, nose, mouth, move on to the neck. This is all, once again, the secondary assessment. Moving on to the neck, I'm looking for tracheal deviation, jugular vein distension, and while I'm here, I'm also going to check the cervical spine. I will palpate the cervical spine. I'm looking for any step off. Since I suspect a C-spine injury, I'm going to go ahead at this point and apply a C-collar, a cervical collar. My assistant will continue to hold C-spine stabilization until the very end of the lab. During measurement of applying a proper C-collar, the directions are actually on the back of the C-collar, and it shows you exactly how to do it. You want to make sure first to remove all jewelry. Remove earrings, necklaces they may have on their face or neck. Remove any protective headgear if indicated to do so. And return the patient's head to a neutral position. The way you measure is from the trap to the bottom of the mandible. You will take your hand, place it on their trap to the bottom of the mandible, right here. It appears to be about 3 fingers in width. I place that on the C-collar. The last hole that my top finger covers will be the placement of the tab indicating the size. It went to the 3rd hole. I go ahead and unlock. Slide the indicator up to that 3rd hole that I covered, and then lock it back in place. Do the same for the other side. Unlock, slide up to the 3rd hole, and then lock in place. Now, On applying the cervical collar, you want to go ahead and slide up the patient's sternum so it stays midline. Place it under their mandible, and then slide the back of the C-collar around the back of their neck. My assistant will adjust their hand to grab the C-collar and help me hold it in place. And then you Velcro it secure. The C-collar should be resting on the sternum and under the mandible. You want to also verbalize that only a medical officer can remove the C-collar. Now you continue on with your DCAT BTLS, your secondary assessment, moving on to the clavicles, the sternum, the ribs, the abdomen, the pelvis. Then you go ahead and move on to the lower extremities. Doing wash rag technique, checking the lower extremities. On this scenario, we come across a fractured femur. So we go ahead and we want to apply a traction splint to this fractured femur. What you want to do is assess distal circulation, check cap refill and CMS, and then go ahead and apply the Sager traction splint. For the Sager traction splint, you have two parts of the main shaft here. You go ahead and attach those. This two-part traction splint works as a ratcheting method. You have this clip that you lift, this spring clip you lift up, and you can retract the traction splint. But as you pull traction, it freely allows you to do that without retracting on its own. In order to retract, you do have to lift this spring clip. There is a guard you place on the top of the Sager for patient comfort. Make sure that the D-rings are up, facing up, so it is easily secured to the patient. Now that the traction splint is put together, you want to go ahead and remove the patient's clothing from that affected limb. So go ahead and cut away the clothing. And then you want to assess the injury, looking for the 6 P's. Assess pain, pallor, pulses, paresthesia, paralysis, and pressure. And notify the provider immediately if they do have any abnormalities and how you should proceed. Now you go ahead and position the Sager splint in your lab sheet. It tells you to go ahead and slide it to the ischial tuberosity of the patient. What that is just sliding the traction splint as high as it can go. Go ahead and slide it up. And then you want to secure the traction splint at the top of the affected limb. Go through 2 D-rings and then back through 1 and secure tightly. Go ahead and extend the traction splint to where the lever is right at ankle level. You have your 3 cravats to secure and your ankle strap. With this ankle strap, you have a large pad and 2 smaller pads. The large pad will go on the posterior part of the patient's affected ankle, and then the loop will be hooked in to the end of the traction splint. Go ahead and hook in the loop part, and then place the large pad behind the patient's ankle. You may have to slightly release the spring clip to properly position the ankle strap. Then go ahead and secure that snugly around the patient's affected ankle. Now that the traction splint has been secured, you want to go ahead and pull traction. You want to pull about 10% of the patient's body weight for the lab, let's say between 10 and 15 pounds. There are 2 sets of numbers. There are black numbers are pounds, red numbers are kilograms. You want to make sure you say 10 to 15 pounds. Secure the upper portion of the shaft as you pull on the lever. And pull to 10 to 15 pounds. Now that the traction splint is applying the appropriate traction, go ahead and apply the cravats. Your other assistant can help you raise the legs because the plastic on the mannequin sometimes tends to tear up the cravats itself. If your assistant is able to help you, have them slightly raise the legs only about 1 to 2 inches, just so you can slide the cravats underneath. First cravat goes high up to secure the top. Second cravat goes just below. And third cravat secures the lower extremities. Once all 3 cravats are in place, go ahead and place the figure 8 around their feet to secure their feet together. Once you finish securing the figure 8 strap, go ahead and check the distal pulse, cap refill, also CMS. Now we can move on to our secondary assessment. Back to our secondary assessment, we're going to go to the upper extremities. Do the wash rag technique, upper extremities. We have done a full head to toe secondary assessment on the anterior portion. Now let's check the posterior. In order to do this, you're going to call your second assistant, and we're going to log roll the patient. Person at the head will count. Make sure when you're communicating with your team, it is clear instructions on when we're going to actually roll this patient. When you're rolling the patient, take control of the upper torso, of the hips, and the lower extremities. Second assistant, hand on the hips, and then bring the lower extremities with us. I'll do the upper torso as well as the hips. On your count at the head, it's going to be 1, 2, 3, roll. Before you do this, make sure you lift the arm on this mannequin just for the ease of the mannequin to come over. And also prepare your spine board. So go ahead and prepare your spine board by removing the head blocks. So nothing is interfering as you place the patient on the spine board. You count.
All right, on 3, guys. 1, 2, 3, go.
Have the patient up. I'm going to assess the posterior. Checking all the vertebrae, feeling the vertebrae, looking for step off. And while you're here, you can also assess buds. Assess buds, blood, urine, defecation. With my other hand, I go ahead and pull the spine board towards us, towards the patient. Get the straps out of the way so the patient's not laying on them. And then we roll the patient on the spine board at the headman's count again.
All right, on 3. 1, 2, 3, roll.
All right, now that the patient has been rolled on, we're going to use the V-slide technique to get the patient centered. V-slide technique, we want to move the patient down and towards the middle of the spine board. And then we move the patient up and towards the middle of the spine board. You want to place the hand on the shoulder and hand around opposite side of the waist. Same with your partner, hand on the shoulder, opposite side of the waist. On the head man's count.
1, 2, 3.
And then place the hands under the arms.
1, 2, 3.
Perfect. Now that we have the patient on the spine board, we want to go ahead and use this opportunity since we moved the patient to reassess the interventions, to check the vitals, and repeat primary and secondary assessments, and gather your field impression. We're going to go ahead and strap the patient in, starting at the torso, then around the arms, then the lower extremities, finally strapping in and securing the head. Make sure the straps aren't tangled and the buckles are not upside down before you strap the patient in. Feed and pull technique, feed, pull, and then tuck in the excess straps. Second strap goes around the arms. Assistant, can you please secure the lower extremities? Feed and pull technique, feed and pull. Finally, we move on to the head blocks. Make sure the head blocks are 90 to 90. Ask your assistant holding C-spine stabilization to place their thumb on the patient's forehead. Their hands will open up, and I will slide the head blocks, pressing firmly against the traps and close to the head as possible, and securing on that Velcro. Once I have done so, the assistant holding C-spine will grab the head blocks and keep the thumbs on the forehead, still applying that manual C-spine stabilization on your count.
1, 2, 3.
And now continue to strap the patient in. As you can see, the straps are underneath the board. What you want to do is as little as possible, as little movement as possible. Go ahead and lift up. Lift the patient up slightly, just to get the strap out. Apply this chin strap. Apply the chin strap. And then one over the forehead. Yeah, that's good. Once the patient is strapped in and secure, your assistant can release manual C-spine stabilization. After you have done this, you want to go ahead and reassess the patient, redo primary and secondary assessments, check vital signs, reassess your interventions, make sure the traction splint is still applying traction, document, and send up that MIS report. The second portion of Performance Test 20 will be the SAM splint and sling and swath. For this one, we're going to demonstrate splinting a wrist fracture. The patient's right wrist will be the affected wrist. So when the patient comes in, I see that it is a right wrist fracture. You want to go ahead and immobilize that arm. So you go ahead and immobilize the arm. Take off any jewelry, any rings that could cut off circulation. While you're doing that, you want to assess CMS. Okay? You want to assess CMS. Also check distal pulses. Check distal pulses and check cap refill. Check cap refill, okay? Now I want to go ahead and measure my SAM splint on the unaffected arm. So go ahead and measure on the unaffected arm. And then make your mold for a wrist fracture. Once again, mobilizing that wrist. Good to go. Now you can place it on the affected side. And then you will wrap with the dressing that you have available from distal to proximal. Ask the patient to go ahead and grasp the end of the wrap. You want to go ahead when you're wrapping where the radial pulse will be. You leave a window so you can actually check the radial pulse to confirm there is still circulation. Just tuck the excess wrap underneath for this one. And then you're able to check CMS once you are complete. You will not leave the excess wrap like this. You would cut it and tie it or tape it down. But for the lab, just go ahead and tuck it underneath and be able to check distal pulse as well as capillary refill to make sure the patient still has that cap refill. Now we're going to go ahead and sling and swath. Here we have 2 triangle bandages. On one triangle bandage, you're going to go ahead and tie a knot at the end. Tie a knot, and that's where the elbow is going to rest. Rest the patient's elbow. The part of the triangle bandage that went underneath is going to go on the inside of the patient. It's going to go towards their affected side shoulder. And the opposite wrap will go on the opposite side. Go ahead and put it so it's relieving pressure from that shoulder. And then you go ahead and secure it at the back. And with the second triangle bandage, go ahead and relax. You want to make sure it's relieving pressure from that shoulder. With the second triangle bandage, you're going to go ahead and just secure it to their body. Lift your arm. Sling and swath.